Men, stop doing Kegel exercises and do this instead. In this video, I'll be going over why you're having the issues to begin with, what is missed in the assessment, how to fix the issue, and what to do going forward. First of all, let's answer the question, why you have this issue. Biomechanically speaking, this is a major issue having to do with the engagement of your body muscles differently. Let me explain. When you are not moving functionally, you are going to use your body differently. Meaning, instead of the muscles whose job is to perform X, Y, and Z, you will grab on any area of your body that will be able to fix or jump in and assist in the movement. When that area becomes pelvis and pelvic floor, now we have an issue. Let me explain. Your pelvic floor is the floor of your pelvis. Its job is not for movement. It is to be the floor containing basically the structures and the organs above, and also be containing muscles that are used for sphincters. They're not moved or used for movement, and yet when we do use them for movement, it becomes problematic. The muscles inside your pelvis work with the muscles outside your pelvis, reinforcing the walls of the pelvis. When there's instability on the outside, the muscles inside will contract. They will do whatever it takes to try to stabilize your pelvis, which is the foundation to the structures above. So when we talk about biomechanics, we're talking about improper dysfunctional patterns of movement leading to you using your muscles inside the pelvis for things that were not their job. So the first thing to do is to find why you're biomechanically dysfunctional, which takes me to the next section. In men and in my practice, I find three major contributory factors. Number one is prolonged sitting. They park themselves on the chair and spend hours and hours doing work behind the computer or their devices. Then they take this tired body to the gym. So now that comes the second one, which is workouts. So an exhausted body, you're asking it to perform. Of course, it's going to use whatever it can to satisfy what you wish for. That becomes the source of an issue. So the exhausted body being told to perform more, it's not going to be able to perform better. Or you are not tired, maybe, at least you haven't been sitting behind the computer that much. You go to the gym, and now your expectations of your gym performance is beyond your body's potential for proper performance. So you have so many sets and reps, so much weight in mind, and the body is going to give that to you because it wants to please you. So your wish and your body's potential don't match. You end up using your butt, clenching your butt to lift that heavy weight or to do whatever it is that you're doing, and that becomes a problem. And finally, from what I see in my practice, I see overly masturbating population, meaning they're just overly masturbating. I'm not a sex therapist here, but I can tell you that in the process of masturbation, that pelvis does not have the thrust that it would, let's say, if it was done with a natural intercourse, and that creates dysfunctional patterns of movement. Believe it or not, all of these make a difference. So then you go and your physical therapist will, let's just say, or whoever, tells you about KEGELS and reverse KEGELS. So KEGELS is the sad attempt of human beings trying to tell you how breathing in, natural biological breathing in process does to your body. So, and then breathing out is or the opposite. So reverse Kegel is more like what breathing in does, and Kegel is what breathing out does. So naturally speaking, we concentrate, at least in my practice, for pelvic stability and for all of these symptoms that are signs and symptoms of pelvic instability. I start with biological breathing, where the patient breathes in through the nose, pretends that the bottom of, or the diaphragm is like a bottom of an elevator going down the shaft. So in the process of breathing in, the elevator bottom goes down and the sides of your body gets pushed out. This is different than abdominal breathing, where you place your hands here and you try to push your tummy out. You can push your tummy out, but that means that you're not pushing the sides out, and potentially you're lifting your back up in the process. So to me, that's improper instruction to try to relax the muscles of the pelvic floor. So biological breathing is what I recommend, and I go through the process of doing it with my patients to make sure they understand. I make sure I put it at the bottom of this, at the end of this video, so you get to see what that looks like. And then you want to make sure that you're basically working out correctly. Your workouts are reasonable for what your body is able to do. So you want to make sure that you change those habits and your exercises are done reasonably and incrementally improving it, which is probably one of the least things we want to hear. So there are many exercises that are being done that just don't work when it comes to doing Kegels for men, or doing exercises for tightness in pelvic floor for men. You have to understand why you have the issue and how to get rid of it properly. Those exercises, in my opinion, majority of them don't work because they don't address the cause. I'd like for you to make sure you subscribe to the channel, make sure you drop comments below, and I'll be able to read and do future videos answering those questions that you may have. Thanks for watching. Take care.